Hi, Merdine here again with the Orange team. Patty Rosenfield is a nurse practitioner who is on my team, and we are going to demonstrate how we care manage one of our patients who is part of our high-risk patient panel. This is something that we do with the patient-centered medical home, where we do care plans, we do pre-visit planning before the patient gets here so that we can figure everything out while he's here and get what he needs. So Patty Rosenfield, who is a nurse practitioner, and myself, also the medical assistant, can also join in, where we will talk about what the patient is needing. This patient is a 66-year-old male who had a fall. He broke his pelvis. He will be coming in tomorrow for follow-up on his VNA needs, rehab needs, physical therapy, medication changes. So we will be showing you what pre-visit planning looks like.
Okay, Patty, so we have George that's coming in to see you next week, and he is here for our ER follow-up.
Okay. Do we have the notes from the ER?
Right, I got them faxed over so I can give those to you.
Okay. Now we'll read them over. And do we know, there was a question about some of the medications. You sent me a message, Merdine?
Yes, the VNA nurse, she called and she told me that she felt he was a little dehydrated. His output, urine output, isn't sufficient. So she said she's holding the Lasix, but she wanted to speak to us about it.
Okay. Well, he has pretty severe congestive heart failure symptoms, and he also has chronic kidney disease. So actually, I didn't start him on the Lasix. So I think we're going to need to look up who his cardiologist is and give them a call and maybe do some collaboration with them to see what they suggest.
Okay.
I probably would want to take him off the Lasix completely. Let's just see what he's on now.
Did he come from Brigham? Hold on.
I'm not sure.
Would you have said it in your note? I mean,
yeah,
he's
it's the Brigham.
He is on very high doses of, many medicines for uncontrolled, unbelievably high hypertension. So I suspect that's why the cardiologist put him on the Lasix. And probably we could take him off it for a short while as long as his blood pressure wasn't critical. But he probably is going to need to go back on that. And do we know he lives with his son and daughter, right?
He lives with his daughter. That's who I usually speak to.
Okay. Yeah, I have met her. She has some. She works as a veterinary assistant or whatever, so she has some medical background. But and she's pretty knowledgeable, and she makes sure he gets his meds on time. Now I noticed there was some question about his pain medications, that he had been on Vicodin.
He was placed on
Dilaudid?
Dilaudid, and he gets a lot of stomach upset and vomiting with that. So that's also contributing to his dehydration.
So he's still on that?
He stopped taking it on his own.
Okay. So do we know, did they give him anything else?
Tramadol?
Okay.
Well, that's what we've prescribed to him from before.
Right, exactly. He's been on the tramadol. He has to be carefully watched on that, though, because he when he gets a hold of it himself, he took too much.
Okay.
Because he does have pain. Though when I see him, he doesn't complain of pain, but, obviously he has pain if he's taking the tramadol. I think he was on narcotics for many years, and his daughter was concerned about it, so she actually weaned him off it, which is great because, decreases the risk of his falling and having other problems and things like that. Okay, so we do have an appointment for him.
Yes, he's coming in.
Do you want me to get the notes from BMC, or do you want me to? Is it from Brigham's?
From Brigham? Well, we had the ER discharge already.
If we get all the notes to see what they were doing as labs and stuff like that, that would be great.
Okay.
And then we can review them with his daughter, and he when he comes in, I can call the cardiologist because he goes to Boston Medical for
Cardiology.
How did he end up at Brigham and Women's? Do we know?
That was just the closest hospital there at the time when he fell.
He lives in Weymouth.
I don't know what he was doing in Boston.
Oh, okay. He was in Boston. See, he was in Boston when he fell?
Mm-hmm.
We can actually get the notes from BMC also.
When,
from his cardiologist.
Oh, yeah. No, I can look those up. BMC, but I just want to make sure that it's not too spread out, that we don't,
I see what you mean.
yeah, that everybody knows what's going on.
Mhm.
Because a lot of times in a different hospital, doctors will change things without knowing the whole story.
Yeah.
So anyways, so it looks like, so is he doing well? Do we know that?
He is doing better. The biggest concern is his pain, and he starts physical therapy tomorrow. So, other than the pain and the concern with the Lasix, he is doing okay.
Well, I can talk to his daughter. Perhaps we can find something that's more of a long-term, medication, like maybe a fentanyl patch or
Okay.
something like that. Or even, but I want to talk to his daughter because I know she has concerns about this.
Okay.
And, I don't want him to be in pain, but I also don't want him to start having a problem again with taking too much pain medication. So, all right. That sounds good.
What you just saw here was the basic model for the patient-centered medical home where all members of the team are working on one patient. So you saw Patty, who was a nurse practitioner and provider for the patient, the medical assistant, and myself as a nurse working together to get the patient what he needed, especially after this fall. We also work with outside sources, the hospitals, the VNA, physical therapy. If the patient needs transportation, then we all try and coordinate the pieces of this puzzle.